The Dartmouth-Hitchcock contract with the state hospital was singed by controversy during the election season. Now another political fire has sparked up as it came to light last week that DH has not staffed the hospital with the full number of psychiatrists it agreed to provide. Joining us now is Executive Counselor Chris Pappas, who helped kind of play a role in bringing all of this to light. Thanks for joining us, Counselor.
Thank you. Good to be with you.
Explain for us what brought you to this line of questioning about what the staffing was like there at the state hospital.
Sure. Well, you referenced the issues that we had with Dartmouth-Hitchcock last year with this contract. There was a lot of concern because there was a labor dispute going on when the positions were transferred from the college to the hospital. There were a number of qualified medical professionals, psychiatrists, who could not negotiate their terms of employment and ended up leaving. And so the state was very concerned that we weren't going to have New Hampshire Hospital fully staffed under this contract. So we had a temporary extension where they were sort of on probation. And when the full contract was approved last fall, we wanted to make sure that we received regular updates, weekly updates in terms of the staffing levels at New Hampshire Hospital. So I looked at these very closely. Over the last few weeks, I noticed that some of the numbers began to dip. And then when I flagged that for the department and they looked into it, they also realized that the numbers that the council and that the commissioner had been receiving were faulty, that there was a gap between where the hospital was saying we should be in terms of the benchmark numbers and where we actually were in terms of the contract. So we were a couple positions below in terms of the number of psychiatrists we needed there. We were missing a geriatric psychiatrist. There are a couple other positions that DHMC has to bring on board by July 1st. So they're out of compliance with this contract. They have a lot of work to do over the next few weeks to get in compliance. We're going to get a response, I believe, on May 9th from DHMC to the department. The department will have about 5 days to assess whether or not that plan is viable, and so we'll go from there.
And that's the context into which sort of, if people are looking at this without that context, they see one or two doctors, they may not think a big deal, but to you guys, given the problems that have happened before, this is why this is a major political controversy right now.
It's a very critical population there. Obviously, the care that's provided is priority number one, and we feel that having the operation fully staffed is really important to making sure there's that quality of care. Now, the commissioner has indicated to us that he doesn't believe that the quality of care was compromised. I think the council and the governor believes that we need to investigate that a little bit further and do a review. So that'll be done. But when you look at an incident that just happened last year, which was very tragic, which triggered a Sentinel review where there was a woman who was discharged and very tragically committed suicide shortly after, there's no room for error in terms of the care that's provided there, and having the New Hampshire Hospital fully staffed is really a key piece of that.
Dartmouth-Hitchcock released a statement pushing back pretty hard on this notion that people were not in the loop. It said in part, quote, "From the inception of this contract to provide clinical psychiatric services at NHH, Dartmouth-Hitchcock has provided the state, including through weekly reports, current and projected staffing levels and any projected deficiencies. Throughout the course of this contract, the state agreed that the staffing levels have been appropriate and the patient care is high quality." They're saying that state officials, at least at some level, knew about this all along.
Sure. You know, they were under the microscope here, and they didn't perform to the level that we expected them to perform. They needed 11 psychiatrists. They had between 8 and 10 over the last few months. That's out of, not in accordance with the contract that we approved. So they've got to come into compliance here. There should not be this kind of finger pointing, I think, going on. I think we need to get everyone into a room, make sure everyone's working in the same direction to solve this. When you look at the overall behavioral health crisis that we have in New Hampshire, this is a small piece of the puzzle, but it's something that we've got to get right, certainly. But there's so much more that we need to do to, increase the number of beds that are available, deal with the overcrowded situation that we see in Elliott Hospital and Concord Hospital, where these acute mental health patients and cases are really just backing up and clogging the system. There needs to be more supports out in the community as well. So we really need a whole, plan. I know the legislature and governor have been working in a bipartisan fashion on finding some more funding to construct some new bed space. I think that's an important piece of the puzzle. So yeah, we've got to get this right. This is important, but this is something that can be solved. When you think about Dartmouth-Hitchcock, they're an important player in New Hampshire. They're a world-class medical facility. They're one of the state's largest employers. I believe they have about 10,000 employees. So I have faith in them that they can fix this issue. They've had a great relationship with the state, providing those docs at New Hampshire Hospital over a long period of time. So we want to see that they can continue to do that. They're an important partner, but really we have to draw a line in the sand here. We can't, settle for less than the number of professionals that the contract calls for.
You mentioned the big picture here. Let's take a step back. You have these issues at the state hospital. DCYF still in need of reform, even though I think the Manchester police chief raised the alarm there about 2 years ago now, in 2015. Mental health services, the opioid crisis. There are a lot of fires burning on a lot of fronts. Do you feel that HHS is on top of all of these things right now?
You know, they are putting out a lot of fires, and I don't believe that they have the staff resources necessary to really cope with all these challenges. We initiated an audit of DCYF. They looked at those cases, some of them very problematic, that have made the news over the last few years, really heartbreaking cases. And what the commissioner deduced from that process was that he needs more staff. There's a morale issue, and I think that's linked to the number of staff people that are out there. So that's the primary thing that I'd like to see come out of the legislature this term. We really need to make sure that HHS has the right number of people there working on a whole variety of issues. That department deals with people who are going through some real tough times, people that need assistance, kids that need protection. We can't shortchange that.
There's a flip side to this too, in that I don't think we can expect HHS to solve all the problems of the world, right? We have some very significant societal problems going on right now. Is that a key part of this? Do you think that what we have right now in terms of opioids, mental health, is that a solvable problem that HHS can get on top of? Or is this bigger perhaps than the government right now?
Yeah, I mean, I think in particular with DCYF, that's a problem that I think staff resources would really aid in helping to address. I mean, I think when you look at the bigger picture issues of mental health, behavioral health, substance abuse, those are things that require cooperation from the community, state, and federal level. Certainly we've been getting a lot more attention and some resources that our federal delegation has been fighting for from Washington. That's not in itself going to solve it. You know, the state's work and the state getting more resources out to treatment, prevention, and recovery is an important piece. That in itself isn't going to solve it. It really starts at the community and family level. We've got a number of great grassroots organizations that have sprouted up across New Hampshire that are doing some incredible work on this, and really they're helping lead the charge. They're on the front lines of this. Our first responders certainly are. You know, I think it's great that the Safe Station program has spread to other parts of the state. Now Nashua has started that up. So we have some interesting things going on in New Hampshire. It's not a top-down solution that's going to make this all work, but it's all of us working together, being creative, thinking outside the box. That's going to help our state in the long run.
I heard you say Washington there. Your name is the one that comes up over and over again when I talk to Democrats about who they would like to see run for higher office, if not in the next cycle, then someday. But you've seemed very comfortable where you are, and you're always kind of demur on these questions. Is that going to continue? Are you just going to stay with the Executive Council, or are you going to reach a little higher at some point?
You know, the council is a real interesting vantage point to occupy. It's such an important piece of state government. We're at the nexus of so many decisions that are made. Just think of the issues that we've talked about this morning. And with the issue around DHMC, you know, you can ask questions and you can really get a response and make sure that there's accountability and oversight. So I like the position that I serve in on the council, and I certainly hope to keep doing it. I also run a small business in Manchester, which occupies a great deal of my time. So, you know, I'm very happy with the dual roles that I have, but I've got a commitment to the state, and so at some point I might think about putting my talents somewhere else. But, you know, for right now, I'm pretty happy with what I'm doing.
And you mentioned the small business there. Is there anything to like? I know you probably haven't opened it up, and certainly seemingly no one has read it, but the Health Care Act that just passed in Congress, anything to like there as a business owner, do you think?
No, I mean, I think it's, you know, I dislike most of it. And, you know, one of the things I think that is most alarming to me is the employer mandate that was pulled back in the act that passed Congress. As an employer, I feel a responsibility to provide for the well-being of my workforce. And so, you know, even before the Affordable Care Act was passed, you know, we provided coverage, and I think that's the right thing to do for employers across the state. You know, when you're looking at a tight labor market, you're going to have to provide a good wage and a good benefit package to attract employees, and I think that's what employers are looking to do in this state. So supporting your workforce is really important, and I'm disappointed that this has passed. You know, no one really read the bill. They rushed off to the White House to celebrate its passage, but they didn't understand the implications in terms of who would lose coverage, what it would mean for people with pre-existing conditions. So I think that's a dangerous way to legislate. I hope the Senate brings some calm to this debate and takes a more sober look at the legislation.
All right. Executive Counselor Chris Pappas, thanks for joining us.
Thank you.